I am Dr. G.P.V. Subbaiah. I am a spine surgeon working in global hospitals, Lakadikapur, Hyderabad. So we are going to talk about the spine problems, the management of the common spine problems we encounter in our day-to-day practice. Spine problems are on the increase. If you look into the statistics, if you look into US statistics, it is estimated that at least 90% of the people they experience low back pain at one or the other stage of their career. If you look into the neck pain, 45% of the people they experience neck pain at one or the other stage of their life. So if you take all these statistics into consideration, you are looking at a very major public health problem, the low back pain and neck pain. So if you divide the spine problems we see in our practice, they can be divided into multiple subheadings. One spine problem is the degenerative spine conditions. These are the most common problems we encounter in our day-to-day practice. Degenerative means as the age advances, there are certain changes that take place in our body. Likewise, some changes they happen in the spine also. So degenerative changes are nothing but a regular wear and tear of the spine. And most commonly, the most common part of the spine which wears out is the disc. If you look at the structure of the disc, the structure of the spine is constituted by number of bones, and these bones are called vertebral bodies, and in between the vertebral bodies there is a cushion like thing. That cushion is called disc, and degenerative conditions most commonly affect the disc. And in the disc problems, they can be divided into two types. One is a disc prolapse and second one is a degenerative disc disease. Disc prolapse is different from a degenerative disc disease. Disc problems can be divided into two types. One is a disc prolapse and the other one is degenerative disc disease. In disc prolapse, what happens, this disc slips back and presses on the nerves coming to the leg. If it happens in the lower back, it can press on the nerves coming to the hand if it happens in the neck. So disc prolapse can happen in the lower back, disc prolapse can happen in the neck. Usually what causes disc prolapse is not clearly known, but the incidence of disc prolapse is more common in smokers compared to the non-smokers. But to be precise, what causes disc prolapse is not clearly known. If the disc prolapse happens in the lower back, patient will have a sudden onset of low back pain, and that pain will radiate down into the lower limbs. Say for example, if the disc prolapse presses on the nerves coming to the right leg, patient will have low back pain, and along with that the pain radiating into the right lower limb. So this is the complaint with which the patient comes to us if the patient has a disc prolapse in the lower back. Say if the patient has disc prolapse in the neck, he will have neck pain and the pain radiates into the upper limbs.